Hello, my name is Andrew Horn. I'm a student here at St. Thomas University, and this is my presentation on cardiopulmonary conditions, and we'll be focusing on arterial thrombus formation. So, arterial thrombus formation, or arterial thrombosis, is the definition for a solid mass that is usually formed of both platelets and atherosclerotic tissue, meaning plaque that's built up in the arteries. Um, so, as we know, these can cause many symptoms, many predispositions to developing conditions such as your myocardial infarctions, coronary artery disease, stroke, peripheral vascular disease, and puts patients at risk for dementia. According to the World Health Organization, cardiovascular disease is the leading cause of death worldwide. That accounts for 32% of global deaths. That is a very big number. But one of the things that we found is that cardiovascular disease, which is a big umbrella term for many conditions, including arterial thrombus formation, is that a lot of these, while they have genetic predispositions, are pretty much a lifestyle related disease. So this is important to know and to when it comes to educating our patients about risk factors and prevention. So, what is arterial thrombosis? Arterial thrombosis, like we said, is a buildup of plaque with fibrin, platelets, and they all kind of create a blockage or alternative route for tissue perfusion. These can be seen as early as age 15, but probably earlier, depending on some sources, due to the increased risk of obesity, metabolic syndrome in our young adults and children. Um, Basically, the main component that is needed for arterial thrombus formation is endothelial damage. There are other factors involved here, and we'll get to that on the next slide. But endothelial damage is basically the first domino of this effect. So the endothelium are the lining cells of the arteries, and they secrete factors like proteins that keep the cells dilated, like nitric oxide, um, antithrombin forming proteins. So they are very protective. And when they become damaged, whether due to viral infections, oxidized LDL cholesterol, platelet adhesion, certain viral infections, like I said, and just hypertension, high cholesterol, high glycemia, all this kind of creates a not so good environment. And then when this damage occurs, these cells then release cytokines and other, prothrombin, von Willebrand factors, things that attract, this inflammatory cascade and coagulation cascade, things that are needed. And these thrombi are secured by fibrin, which makes them very tough and resistant. So going on to the next slide, we have Virchow's triad. Virchow's triad is was discovered by a scientist named Virchow. And basically, it's a symbol or a network of things that contribute to thrombosis. So we have here, as this diagram shows, figure 1 from the Kahn et al. Study that looked at thrombus formation in pregnant women. These were all kind of interchangeably and all kind of required for thrombus formation. You have stasis, vessel wall injury, hypercoagulability. Since we're talking about arterial thrombi formation, in the artery, a little bit different from venous, thrombi, where stasis takes place more frequently. In the arteries, we're not usually having a problem of stasis. It's usually a redirection of blood flow or different perfusion network related to the clot. So the tissue or the makeup components of blood don't usually flow the same way, and this is due to physics. So usually you'll find that the red blood cells, platelets, and all that kind of flow in the middle, and then the less dense materials like your glucose, your other protein molecules, and that are the ones that are coming in contact with the endothelial. So when that clot is, blocking flow, these components that don't normally come in contact with the endothelium are going to come in contact and cause damage. And especially if there's a state of hypertension where there's a high pressure state, this creates the perfect environment. So that's one thing to keep in the back of your head here. And hypercoagulable states are called thrombophilia, and these can be anywhere or any conditions including pregnancy, which is a normal state for thrombophilia, liver dysfunction, taking birth control pills, and cancers are a big thing, and also smoking contributes to this as well. And then, like we touched on the last slide, endothelial damage or vessel wall injury are needed for these thrombi formations to occur. On this slide here, figure 431 comes from our Goulash textbook for advanced practice registered nurses pathophysiology. And you can see here each of these columns kind of demonstrate the formation of both atherosclerosis and the at the very end arterial thrombi formation there with the bundle of fibrin around the platelets and red blood cells there creating a blockage. So as clinicians, we need to understand very thoroughly what our risk factors are in order to teach our patients better lifestyle management. Just like with any condition, we have modifiable and non-modifiable risk factors. Our modifiable for arterial thrombus formation include smoking, obesity, high blood pressure, high cholesterol, uncontrolled blood sugars, and leading a sedentary lifestyle, and also certain viral infections. And the reason why this is under modifiable is due to patients not receiving appropriate preventative measures like vaccinations or using appropriate measures like masking and hand hygiene, which we'll talk about in a little bit in reference to COVID-19. Non-modifiable risk factors are things that we cannot change as easily. These include states of pregnancy, advanced age, genetic predispositions, having cancer, and a familial history. COVID-19, we know from the past couple of years now from this pandemic, is a virus that is a upper and lower respiratory infection. It needs the ACE2 receptors to bind in order to enter cells and cause replication and havoc. The ACE2 receptors, as we know from physiology, are very abundant in the arterial network system. So it's no surprise that there can be clot formations here and causing that endothelial damage we just talked about. And according to this one study here by Glober et al. 2021, they kind of looked at 50 patients who were in the ICU sick with COVID-19 and those who had comorbid symptoms that associated with metabolic syndrome did less well and had higher rates of thrombi formation. So very important. And another study we'll talk about here really briefly is Monica et al. And this looked at certain genes that if they were altered, would they cause a possibility of having a clot form too. And these are your PEAR1 genes and MRV1I genes. And these genes influence protein coding for those protective proteins that we talked about that kind of prevent clot formations and whatnot. So presentation as a clinician, we need to know how these patients are going to present with certain symptoms. The thing is, we don't always know when a patient has arterial thrombosis. So it's our job to investigate further using laboratory studies and non-invasive techniques. So these include your CBCs, PT, APTT, INR, all things that are going to look at your platelets and coagulation states, your liver function test, renal functions. Lipid profiles are very important for primary care. As we learned from the previous slide and from atherosclerosis formation, cholesterol plays a big role in that, along with our A1Cs with diabetics. And these, with deviations, we can kind of catch risk factors in the formation and hopefully lower those for our patients. One thing we need to talk about too is when patients have symptoms, it's usually due to the fact that the condition has become now acute. This is usually a silent condition, but once their symptoms arise, this is usually not a good thing. But one thing we can do with like our chest pain patients, or patients who are feeling dizzy and whatnot, is like from the diagram here, this is your ST elevation myocardial infarction from an EKG. Very non-invasive, very easy test to do. And that tombstoning there right next to the QRS complex is indicating that there is total blockage, total ischemia. And this person needs to go to the cath lab to have their heart, reperfused, or they won't have a heart. And with AFib, we'll talk about in a little bit too, that AFib requires anticoagulation therapies to prevent clot formations as well. So like we just talked about certain conditions, these include like stroke. These are all associated conditions that arterial thrombosis can affect. Pulmonary emboli, STEMIs, With this little picture here, and this is a CT scan of a calcium score study, and the arrows pointing to calcium deposition indicate arterial thrombus formation and atherosclerotic plaque. And this is kind of a preventative, non-invasive scan that can be done to predict patients' risk for needed interventions to prevent a myocardial infarction. Treatment for arterial thrombus formation is going to vary widely. The main component for practitioners is going to be prevention. We want to talk to our patients and really educate them about changing lifestyle factors like smoking cessation, keeping their blood pressure, their glucose under control, increased diet, lowering their cholesterol, incorporating more of a plant-based diet. A lot of these things are going to help overall keep them healthier and reduce those risk factors for clot formations, as well as being vaccinated and reducing the risk of exposure. And then again, too, about our patients with AFib, usually over 60, we want to start them on anticoagulant therapies because patients, the rate of ischemic strokes, about 25% of those are related to uncoagulated AFib. So very important. And some of these medications are going to be antiplatelets and anticoagulants. Usually antiplatelets we start once patients become symptomatic, especially with chest pain or peripheral arterial disease. And then when patients become severely acutely sick, we usually reperfuse them in the cath lab. So this is going to be your STEMI patients or your stroke patients. And as an alternative, or as we transfer patients, this is an ACLS protocol standard, we can give TPA, which is a clot-busting drug, in order to buy these patients time before they get to the cath lab. So very important. They need to meet all the, they need to not have all the risk factors in order to receive that medication. So on this slide here, by Thrombosis Advisor from YouTube, a very nice educational video, is kind of ties it all together from start to finish. So I'll leave that in the link there. You can go ahead and watch it. It's about a minute and a half. Very, very good material here. And these are my references for this presentation. Hope you all enjoyed this presentation. Thank you very much.